I told you the best part we were saving for last, and it's true. We are about to do a really cool demonstration of Oculus technology. We've learned today that telehealth is as good as conventional medicine, that it allows a lot of flexibility in workflow, all sorts of wonderful things. But what we haven't talked about is how it can really be better and explore many new avenues of communication with patients. It's not just about reproducing the way we used to do medicine. It's about moving into a new frontier and embracing new technologies to allow ourselves a better way to communicate with patients. It's not just as good, in many ways, it's better. You can, with new technology, imagine if you flew through the body as you did in that Disney ride, you know, and the red blood cell and you went through the body. I mean, you can do that today. You can do flow studies with MRI. You can do all kinds of things and fly through the body virtually, virtual colonoscopy. Imagine together with your patient flying through their colon and stopping and looking and backing up. A little dirty, but that's okay, it's virtual. So with that, I'd like to introduce, you've already met Erin, so I won't introduce Erin again, Erin Hulfish, who has been transformational in the telemedicine program at Stony Brook. But I'd also like to introduce Dr. Hal Skopicki, who was kind enough to come today on his clinic day. He's the chief of cardiology in the Department of Medicine here and a big supporter of the telemedicine program. And he and Erin together are going to take this from here. And with that, Hal, welcome.
You could have picked the heart, not the colon, to take everybody through.
Well, I figured
We're going to deal with the heart of the matter right now.
Exactly. And this is the central issue of our body. We can all do without our colons.
So good afternoon. Thank you for everybody who's stayed around. This is going to be hopefully one of the highlights part of the day where we're going to be a little bit more interactive. We're going to start this afternoon's session with Dr. Skopicki demonstrating some of what we actually do in our medical student courses that we've developed, which is taking virtual reality for a spin throughout the body and having him come as one of our amazing experts in cardiology to allow us to explain how we can use some of this technology to not only our educational benefits, but for our patients' educational benefits. After that, we invite you to join us in the outside Zodiac Gallery where we had lunch. I'm going to be running through one of our cases that I've modified for an interactive session of how can we change this into telemedicine. We've also got our interactive technology booths that's set up that'll be able to demonstrate a little bit about what we're going to see in just a few minutes here on the stage. And then we also have one of our other presentations going off in the gallery that's talking about our interprofessional group. Again, we're really excited for this entire day. We're really grateful for Dr. Saltz for having us and making sure that everything has been going as great as it has been. Dr. Skopicki.
So thank you for inviting me here today, and I'll just say a couple of words because I realize I'm standing in between you guys and leaving or going to get to play with some of the equipment. I was in clinic today, and the first 4 patients that I saw, the first one walked in and didn't have any of their records. They assumed that their records were going to be transferred over, so the records they had at their home, you know, they didn't think that there was a need to bring it in. Second person walked in, and I started to try and get a history from them, and they were saying, oh, no, my daughter knows everything. And I'm like, where's your daughter? She's at home. The third patient came in and said to me, you know what, I really, really like you, but, which is something we hear a lot from our patients, but do you know how long it took me to get an appointment with you? I really, really like you, but do you know how long I've been waiting out in the waiting room? And the fourth patient came in and said, you know, I've been having chest pain for about 3 or 4 weeks, and you know, I decided that since I had an appointment coming up in a few weeks, I would tell you then. You can see that each and every time we're having interactions with our patients, they're suboptimal because we're not available, or there are barriers in between our patients and us. And one of the things I'm most excited about in the new age and the new world and the new technology that we're coming to is not just being able to kind of show them pretty pictures or show them three-dimensional pictures, but actually being able to get closer to our patients, eliminating those barriers in between them, making sure that if they have a symptom, they're immediately interacting with us over those symptoms. You can imagine that that'll start resulting in, 1,000 phone calls, but patients learn very quickly. If a patient says, I had chest pain, and I say, that's nothing. Let me go ahead and show you what it is. Then I'm not going to get the second, third, fourth phone call. Likewise, I'm not going to miss the patient who's actually having something going on and being able to interact with them, being able to interact with their family, being able to show them in real time what lifestyle choices mean to what their arteries look like, what their hearts look like, what taking their medications does for their heart muscle or for their blood vessels as they're being more compliant with that. So with that, I'm very, very excited for not only what you've seen a lot of today, but what is being born out of the thoughts and the different types of interventions we're going to be going through over the next several weeks, months, and years. And I urge everybody in the cardiovascular space, but in the medical space, to really be thinking about what are the next steps and how do we get closer to our patients, how do we deliver better care for them in a time when it's getting increasingly difficult for a single physician, nurse practitioner, or nurse to be able to deliver that care as expeditiously and as efficiently and as well as we possibly can. So with that.
Let's go.
Put the pointer to the top of the book. The top of the book left. Click that. And go to the heart. We're going to do coronary artery, or you want to do?
Are they able to see this?
Yep, well, I see what you see.
Okay. So I have a whole palette and a whole menu of different things that I can be looking at. So if my patient came in complaining of a little bit of fluttering or palpitations, I could go through this entire arrhythmia panel and be able to kind of start describing to them some of the ways that their heart is changing or that I'm thinking about what their heart is doing. Here in the coronary artery disease panel, I can begin to start showing them what a normal coronary artery looks like. The walls of the artery, the muscle that surrounds the wall of the artery, and the blood cells, white and red blood cells that are flowing through. I can then go and start to explain to them what happens in coronary artery disease, where all of a sudden cholesterol that's flowing through their blood vessels, all of it, when the artery starts to develop little openings in it, and cholesterol can start to collect. As the cholesterol starts to collect, white blood cells get into these areas and start to gobble up the cholesterol, causing scar formation or a fibrous cap to form on top of this cholesterol. So when I'm talking to patients without these aids, what I'm saying to them is, you got a lot of cholesterol in your arteries, and it can get in your blood vessels, and it can get into your arteries and cause problems. Here I can actually show them that what's starting to happen is the artery is starting to get blocked up. Blood flow here is accelerating. And you can see on both sides the cholesterol starting to grow. As the cholesterol starts to block up the artery, what you see is less blood flowing. And down on this side is where the heart is. So the further the blockage, the more likely it is that the heart muscle is going to be start to complain, and you'll have chest pain. At this point in time, I don't see it actually as a choice, but I'll be happy to go ahead and describe it. What I tell them is a part of this blockage can break off. And when it breaks off, the body thinks that there's a hole in the artery. And so within the bloodstream, blood cells, platelets, that are responsible for closing up arteries, should there be a problem, start to attach here and eventually form a clot that completely stops blood flow through that artery. When that happens, that's what we call a heart attack, because the heart muscle is no longer receiving blood flow. We can then take a metallic device called a stent via a catheter and localize it around that blockage. And we blow it up with a balloon, and now you have this metal stent allowing and restoring blood flow through the artery. I can then go ahead and explain to them, when the heart muscle doesn't get enough blood flow, the walls, the pumping mechanism of the heart muscle, no longer has the ability to push the blood out into the blood vessels, and the muscle starts to fail. Let me just see. What's happening, and I apologize for not navigating it through, is you can see that these walls are starting to, the entire heart muscle is starting to get larger. As the strain on the heart muscle increases, because those walls are no longer getting enough blood flow, those areas cease to be able to pump blood out of the heart. The heart muscle gets larger and larger, and as that heart muscle gets larger, no longer able to push the blood out through the aorta, the blood backs up, and it backs up into the lungs, causing them to feel short of breath and to start swelling. So what we try to do to heart muscles is we try to go ahead and treat it in different ways. One of the things that happen if the heart is beating quickly is you can see that the heart muscle beats so quickly that the blood comes in and then goes out. But the heart doesn't have enough time to fill up with blood from the top part of the heart before it pushes out. So less actually comes out. If we use medications like beta blockers to slow the heart down, it'll allow the heart to fill up more and push out more. And so we can demonstrate with a beta blocker, what I'm doing is slowing the heartbeat down and allowing more to fill up and therefore more to come out. All right.
One thing I'd like to add to that very interesting presentation is that what Dr. Skopicki is seeing is very different from what we're seeing on the screen. He's got a 3D virtual reality headset, and I encourage everyone to look at those outside the room to share the experience that he had. And the vision is that both the physician and the patient would have headsets that would allow them to see this in 3 dimensions, real time, where you look one way and it's as if you're immersed in the vessel. This looked a little bit more like a video, but that's not what it is.
Okay, so now we're going to break out and allow you guys to have a little bit more of an interactive experience instead of sitting right here and watching us all talk. We invite those of you that want to experience with the virtual reality 3D, you can come up here. Dr. Noel will help you out with what we've got. We also have 2 additional virtual reality oculi in the main lobby. They don't have the heart function, so if you're specifically interested in the heart and the anatomy function, that'll be in here. We have also the breakout session where we'll be doing some little simulations and talking about how that relates to telemedicine, what we can do to put that in context, as well as website manner. I'll be leading that. And then we have our interprofessional stand as well, and the technology stand outside. So you guys are released from your seats. Thank you very much.